Welcome to Research Perch from the Massage Therapy Foundation. Short, practical insights into massage therapy research and how it can benefit your practice.
Welcome back for part 2 of our discussion about the massage therapy program at Blessing Hospital. Please see part 1 of this episode for more information.
I have to ask, so somebody's in rehab and they're there and Cindy goes in to treat them. What is the cost to the patient for Cindy to see this person? Karen, Laura?
Karen, do you want to take that?
Sure. Yes, this is a service that Blessing Hospital provides complimentary. We feel that it is such a valuable service that we don't want someone to feel strapped that they can't afford to have this service come in. So it is absolutely complimentary to any patient who the nurse and or physician feel it is appropriate. I will tack on, while I have the floor for a minute, Cindy made a good point that I failed to say anything about. When we do hire these massage therapists, we do allow them to keep their private practice going as well. That was a huge thing for so many of the massage therapists. They want, they've established some wonderful friendships, maybe for, 5 years with their clients, and they didn't want to give that up. And Blessing Hospital felt very strongly that it's the right thing to do in the community, not to take these people out of their private practice, just to have them come in. So I did want to touch on that, and thank you, Cindy, for bringing that up.
Oh. Laura, anything else that you wanted to add with that as well?
The payment piece, I must say, there was never a discussion if we were going to charge a patient for the service. Not ever. From the very first thought was, this is something that we want to provide to our patients to enhance the experience they have within the 4 walls of our facility. That's how dedicated and committed we were to ensuring that we brought this program to fruition. What we have talked about is, how do we start branching out a little bit, start supporting different service lines, start supporting staff, and then once again, COVID hit. And so all of those discussions just kind of go by the wayside. As COVID becomes kind of our new norm, we're slowly ramping up, kind of getting back to where we were, which, as we all know, is going to look vastly different than what it did close to 9 months ago. I think that at some point we will get to a place where we are able to offer this valuable service to employees. And I know, Cindy and her colleagues are very passionate about wanting to ensure that they are able to provide the service to the staff during these very stressful times. And I want to compliment Cindy and that team, because they too are in a very odd situation where they're in a hospital, and ultimately they could choose not to be here. They could say, I have private practice and this is just not for me, and this is not where I want to be right now. And they've not done that. And so I commend them for wanting to continue to be part of our healthcare team. As an organization, we've pulled out all the stops to ensure that our staff, regardless of the role that you play in this organization, that they are protected with appropriate PPE, appropriate education, even though it's vastly changing on a minute-by-minute basis sometimes.
Sure,
but
sure.
That team could have very easily said, you know what, I've got private practice, I'm good.
Yeah.
And they didn't. And so bravo to your team for wanting to continue this journey in healthcare in a vastly different way than historically what your profession has provided. So bravo.
Yeah, well, bravo to you as well, because of you know, that vision that you have, that mission is just pulling people in the slipstream of that. So that's a very cool thing. You know, one of the things that we're the Massage Therapy Foundation, and, you know, we love research. And so, you know, I'm listening to this and thinking, boy, there are some potential papers in this about patient satisfaction, about, you know, med use, about, there's so many ways that you could track some of the implementation of this and its effect on, yeah, even just, you know, outcomes for patients, even just as broad as their experience of being in the hospital, or, wow, there are tremendous possibilities once we look at this for some pretty cool papers to shine a light on the good work that you're doing.
And
you know,
Douglas,
it's interesting because, oh, go ahead, Karen.
I'm sorry. I was just going to say, and Douglas, the other thing that I see, I meet with each massage therapist once a month, and I see professional satisfaction as well from the massage therapist. They will come in and they'll say, you know what, I got to see a baby born today. I got to help, you know, the birth of a child, or I got, you know, we have hospice too. We have, Cindy does a lot of hospice, and we have another hospice trained massage therapist, and they'll say, I am fortunate I got to spend some of the last living days of that individual. I got to be with them. I got to comfort them. And not everybody can say that. And so I see a lot, I mean, yes, it's about the patient first, no doubt. But I do see a lot of professional satisfaction in what they come when I meet with them, and the passion that they bring because of that professional gratification.
Wow.
So it's kind of a win-win.
Yeah. And just that sense that you are really making a difference in somebody's
Correct.
life.
That's correct. And that's what they'll say, you know, I love my clinic practice, but this is a whole different level of satisfaction. They're satisfied there, but this is a different level of satisfaction. Not that one's better than the other, just different.
Sure, it is different. Laura, you were going to say something as well?
You know, it was this whole program, like I said, came as a result of impacting pain management scores through our patient experience. And, you know, we're going to have to come back together to try and figure out how we capture that data, because unfortunately, HCAHPS has changed. And we're not asking that pain question of our discharged patients any longer. And so we are going to have to come up with, you know, what parameters, what gauges are we going to use to measure success from a patient perspective? Because I think ultimately the overall patient experience is extremely important. What this group is doing is impacting a very specific area within that experience. And so how do we capture that definitively with data? You know, I think in the last 9 months or so, and Karen and Cindy could speak a little bit better about this than I could, I think that we've probably seen a vast reduction in utilization, partially because of census. You know, when COVID first hit, our hospital census went from 270 to 70. it was significantly impacted, and we're slowly starting to ramp up again. So, you know, having this conversation, it brings to my mind, you know, do we need to kind of do a reboot of the program, just from an informational perspective for staff? You know, since COVID has hit, we've also onboarded approximately 52 new nurses, and we need to do a better job of bringing this education around the service that we provide to that staff as well. And so, Karen, put that on our next week's meeting. We probably need to have a conversation about that, because I think ultimately it's time. We're all slowly trying to reopen again, and so I think it would be in our best interest to figure out how we bring light to the program again.
One of the things I want to say to follow up on that, during COVID, during the shutdown, during the shelter in, massage therapy continued, and it never stopped. So for those that work full-time and part-time, they went in, and so the census was low, but we were able to, they allowed the schedule to be adjusted that it at least one therapist was there daily instead of two. And so I thought that was fantastic that my colleagues got to continue to work. And then eventually, like all staff, we were called back in what was called a labor pool to help with screenings and some of the behind the scene work to keep healthcare providers safe with PPE equipment, connecting patients to their loved ones because no visitors were allowed in. I loved being a compassionate care person where I got to take the iPad up to them. And I felt like that, you know, and meet up with their people by way of iPad, Zoom, or FaceTime, I believe, were the two options. And so, again, we were still very much a part of the community of Blessing through that period when the hospital was kind of like a ghost town, you know.
It was.
Amazing. But I have to say that Blessing really prepared early. I could see those preparations taking place in late January, February, until the middle of March. And so I'm just very grateful that they kept that program going.
Wow. Well, as you might imagine, for all the people watching this, there might be people who are, you know, connected to a hospital. Certainly there'll be lots of therapists watching this, but for someone who's connected to a hospital, is there something that you would like to say if there's, you know, some, you know, hospital personnel person who's watching this saying, gosh, I wonder if we should consider something like this? What is it that the three of you would like to convey to that person?
You know, honestly, Doug, I would say take the risk. Take the risk, because at the end of the day, it's the right thing to do. I mean, at times, you know, the word risk, in my opinion, sometimes has such a negative connotation. I'm very much a person that I embrace change, I chase change because it excites me. And, you know, this type of an endeavor was so far outside of our box. And I think the reason that I say that is because we're a conservative organization for the most part. We're kind of techie, you know, for the size of our organization, but you know, we're fairly conservative. And you know, for us to take this kind of a leap, you know, to me speaks volumes to the importance of chasing change and taking a risk. And you know, the overall cost of the program was minimal. I mean, you know, we brought people in that were already experienced. Their orientation was very, very minimal, because a lot of times when you're bringing program in, you're looking not only at labor, but you're looking at, you know, other expenses as well. And honestly, to start this program, it was a labor endeavor, but there was very, very minimal expense after that. You know, we're not generating revenue, so you can't capture anything from that perspective. But you know, the other piece that I would say is that we're also capturing very satisfied employees as well, which to me speaks volumes to the importance of employee engagement to our organization. Yeah. You know, it just, the cost to me, like I said, it's just so minimal for the amount that you're going to bring back, not only from a staff perspective, but also from a patient perspective. And, you know, we haven't come up with that magic bullet of, you know, how do we capture what the patients are saying about it, other than very anecdotal pieces that Karen alluded to through discharge phone calls or notes, you know, that verbal interaction that the therapists have with the patient, so on and so forth. And so, you know, I think that's one of our next steps as well is, you know, how do we capture what the patients are experiencing with this particular service? I'm sure at some point we're going to be challenged with that, and, you know, more to come in this, you know, new endeavor and new world of bringing this type of a therapy into the four walls of a hospital.
Thank you so much. And Karen, anything you want to add to that as well?
So just to echo what Laura is saying, we have found it absolutely beneficial to our patient population. As I alluded to earlier, so beneficial that we expanded it throughout the organization. I'm going to say we probably expanded it within the first 3 months of its inception.
I think so.
Yeah, we found it that beneficial to our patients. So I don't really have a whole lot else to add other than if anybody has any questions or concerns or how did you do this and what about that, please give them our contact information. And I don't know how this works, Doug, whether it's included with this or not, but I am happy, as I probably am speaking for Laura and Cindy as well, we would be more than happy to talk to you about it one-on-one, three-on-one, whatever it is. If it's a business end, Laura and I can, answer maybe, but I defer everything to the expert, Cindy and her peers when it comes to the actual massage techniques and what they do. But that would be the only other thing I would add is please reach out to us and we can tell you exactly how we did it and perhaps help you tailor it. And not everything was perfect from day one. So we have learned a lot and we can perhaps help with that as well.
Thank you so much. Thank you so much.
Thank you.
It's wonderful. And Cindy, for therapists who are considering something like this, what would you say to them?
Yeah, I think if an organization, a hospital is willing to take a leap of faith, that you may surprise yourself and find that you really like this work, and you'll learn a lot from being around other healthcare providers and being part of the team. I know that one of the most beneficial experiences that I've had is when a team does come in, for instance, to do an ultrasound IV, which is difficult for the patient. It can be painful to try to get a very difficult IV in. When a team came in, I happened to be there. They said, "Oh, no, stay." And he was training some nurses to do this. And I stayed, I did massage. While they did that, the patient didn't feel a thing. And they were like, "You're coming with us."
Wait a minute. Let's talk about what department this was, because they're not stealing anybody. Let's have a conversation offline.
Okay. Wait a minute now.
I was just beaming, that I gave a good patient experience. I was able to really be a part of that team as they were doing a procedure. So I just felt great. I walk out of that hospital feeling really good on many days.
Yeah, as you should. You should all be incredibly proud of the work that you're doing and the impact that you're making on the community. And through this episode, hopefully the reach will be a lot farther. And on behalf of the Massage Therapy Foundation, it's our great pleasure to shine a light on the really cool stuff that you're doing. And Laura, you mentioned this, so I'm gonna take you up on this. As you find new ways to maybe capture that patient experience and move into that, whether it's qualitative or quantitative, I'd like to circle back on this and explore that together. And we do have our journal that you could publish that in and at least do a submission. Just saying.
Well, Doug, okay, I'll find time.
Yeah, that's right.
First and foremost.
No,
honestly, you're absolutely right. I mean, I don't think that we give ourselves enough credit for some of the great work that we do. To me, Karen put this on the list again as well. We're in the process of going through our magnet journey, which is a nursing accreditation for an organization that is not easy to get. It proves to the world that our nursing division is in the upper echelon of care and quality. And they're always looking for these types of stories to show why we are deserving of this type of designation. And, we have a nurse researcher who's actually helping to lead that application process. And, we've had some inklings with students becoming involved in integrative care, but, to your point, we need to do a better job of highlighting the uniqueness of this relationship between massage therapy, patient care, nursing care, and what kind of outcomes we've seen. I don't know how you capture that. And I think that's a journey that we definitely need to start.
Very cool. Very cool. Well, this has been such a pleasure to spend some time with you, and again, to shine a light on the great work that you're doing. And again, on behalf of everyone at the Massage Therapy Foundation, we're really, again, just really proud to do that, to shine a light on the work you're doing, and look forward to what's to come and some really good things as a result of this. All right. So
thank you.
Thank you to all three of you. Thank you, Karen. Thank you, Laura. Thank you, Cindy. And thank you for everyone who's been watching this episode. I think we may have split this into two, but thank you so much for taking the time to observe this and for your support of the Massage Therapy Foundation.
If you enjoyed this podcast, please consider donating to the Massage Therapy Foundation so that we can continue to bring you this and many other resources to increase your knowledge and improve your practice. Thank you.